And yeah, for me, I would rather have it done by a surgeon than someone who normally does something else and can also do this particular procedure. You know what I mean? Here, what noise do potatoes make? Hey, I'm coming to you from the future. Kind of, sort of, not really. I'm now post-surgery to tell you that since I recorded the clips for this video, I have decided to split them even further because, of course, all of my videos are too long. We know this. So this is part 2 of the tongue tie videos that I am posting, and part 3 is also currently in the making. So if you haven't seen part 1 yet, go and watch it here, I guess. And yeah, let's go. Hey, how's it going? It is Friday evening. I've had a terrible day because of other people creating a lot of unnecessary, pointless work for me. Anyway, whatever. So I went then back to the place where I got my wisdom teeth removed. I didn't see the original surgeon who took out my wisdom teeth. I saw a different doctor who took out my stitches, and then I was asking her about the tongue and lip tie release and whether they do it at that practice, because I forgot to ask the last time, and what their opinions are on the different techniques and things like that. And she said that I could book an appointment for a consultation, but when I explained that, well, actually I already have appointments booked with 2 other places in the next couple of weeks, and it would be great to know today, then she did go and get the relevant person for me to speak to, which was really good, especially because it was unexpected. So then one of the top surgeons came in, not the one who will be doing my main jaw surgeries, but the other main surgeon there. He came in and spoke to me. It was quite quick and it wasn't very detailed, which is understandable because, as I say, they weren't expecting it, and it was really good that they even were willing to see me. He was super nice. I asked him a bunch of questions, and some of them that he answered, and then the more I was asking, he was being really nice, but he just kind of looked at me and he was like, I think you're thinking about it too much. It's really a very simple procedure. And he said that should they need to revise it, then they can just do that again when I get my other surgeries done at the same time. So I think it's kind of like with the dentist that I saw earlier in the week. He's a dentist and he normally doesn't do that procedure. He does it, obviously, but just he's usually a dentist. Whereas this one, he's a face surgeon. So I think from his perspective, he's like, look, I literally cut people's faces open. This is nothing to me. So again, he said it, not in a dismissive way, but in a nice way. He was like, it's very simple, it's fine. Because I was asking about, anterior versus posterior, and if it'll go far back enough and stuff like that. But yeah, so then I'm gonna go with them and get it done in 2 weeks, which is actually the same day as one of the other appointments, which is great because then I don't need to reorganize anything for that. And yeah, for me, I would rather have it done by a surgeon than someone who normally does something else and can also do this particular procedure. You know what I mean? And this is also, as I say, the same place that will be doing my main surgeries. I've already had a good experience with them so far. So yeah, and they're going to do it then with scissors and a scalpel, and then stitch me back up. So I was already leaning towards doing it with scissors and stitches anyway. So this is good. I'm happy with that. And then this will also be covered by the health insurance, so I don't have to spend 500 to 600 euros on it. So that's good. That is all for now, and I will see you soon. Hey, how's it going? Today is Thursday and I had my second speech therapy appointment today. It went so much better than last time, so I'm very relieved about that, and I'm glad that I gave it a chance. So it was the same woman, I'll be with her all the time. We got straight down to it, which is great. And she also right at the start asked me for a bit more information about what was confusing for me last time, and what might work better for me to get a better idea of my learning style. And then she actually took that feedback and that's what we did. So that was really good. It was really nice of her that she actually took the time to do that, just rather than being well, this is the way I teach it, so whatever. Not only did she want to actually be able to show me in a way or teach me in a way that would be good for me, but she actually, addressed that head on at the start. So that was really good. And then she showed me like 7 different exercises to do compared to the one that we really struggled to figure out last time. So that was really good, and she was like kind of showing me the picture in the book, but she was saying, like, this is really confusing, so let me show it to you. And then she showed it to me, and she did that for all of them, and then like she would show me, and then I would copy it, and she would, check to make sure that I was doing it correctly, and I would ask like the clarifying questions and stuff like that. And at the end, when she showed me everything, then she photocopied the pages for me, so that because like she asked me if it would help, and I said yes, because now that you've told me what the pictures mean, I'm not going to remember these exercises, but if I have the pictures at home, it will jog my memory, and then I'll remember like, oh, so this was the one where you're supposed to do that or whatever. So she photocopied those for me, and then she also let me make my own notes before I left about like how to do them and what they were supposed to be for and stuff like that, so that I would be able to do them correctly before I forgot. So that was really good. I'm much happier with the way that was. I think I told you as well that I decided to go with the oral surgeon, the maxillofacial surgeon rather, for the tongue and lip tie release. So that is then happening on Wednesday. So because that's with the scissors and the stitches, I think you're not supposed to do therapy for about a week afterwards. So I cancelled the next speech therapy appointment, but then she's on holiday for a little while, so I asked her like, can I already get some stuff that I can do after that? So she was saying that actually the ones that she gave me today I can also do. So I think maybe that's why she gave me so many. Like I was asking her, should I just do some now and then do like add the rest afterwards? But she said I can start doing already. So that's really good. Let's obviously see what difference it makes. I'm going to try real hard to remember to do them. She said like in general it's good if I do them 4 times a day. But then she was a little bit like, or maybe 2 or 3 or whatever. But I'm going to try and do them at least 4 times a day to try and, just do the best that I can for myself and get the best results. And then let's see. So yeah, a much better experience this time. Hey! Today is Friday, and this morning I went in for my checkup after having my wisdom teeth removed about 2.5 weeks ago. And I then also had another chat about the tongue and lip tie release because I'm getting it done in the same place. So just went over like the procedure a little bit and the disclaimers, the risks. And I was able to meet the surgeon who is going to perform it. She's really nice. I really get the impression that like because they're like oral and maxillofacial surgeons or maxillofacial surgeons that basically do like major operations on the face, like the tongue and lip tie release is nothing to them, whereas like going and seeing a dentist about it, it's like more of a thing, which is totally understandable. But it's just funny, like the comparison of how they how they treat it and their attitudes towards it. Not in a bad way at all, just different. So yeah, and one thing that I asked the surgeon, because in the last couple of weeks I've been paying more attention to my tongue, looking at it, trying to see about like how far back they might have to go. And I've noticed that as well as having like the anterior frenulum, so like the main kind of stringy bit in the middle, that there's actually a lot of attachment next to it on either side, and also coming around the sides of the tongue as well. Like when I move my tongue around, like the floor of my jaw and the fascia really lifts up a lot. So I don't know if that's what people mean when they talk about a posterior tie. I'm not sure, but yeah, because I was a little bit concerned that maybe they wouldn't cut enough or cut deep enough, and then with the risks, that was one of the things that they mentioned. They said the biggest thing is maybe that they don't cut enough. So when I saw the surgeon, I asked about that and gave her a look, and she said they'll need to also cut around the sides, and she seemed like quite comfortable, and that she knew exactly what to do, so that's fine. Let's see. And when it gets done, I know that it's not uncommon to have a revision. But yeah, I'm really hoping for good results already from the first one that is going to happen on Wednesday, so in less than a week. And apparently I should be able to eat all normal foods after the procedure as well. So let's see about that. That would be really good, because the whole baby food liquid diet thing was not fun. And yeah, just really looking forward to having it done. I'm also going to get the lip tie released as well, and they said that like It's possible that I'll maybe have some aesthetic changes because the tie isn't there anymore, so then the lip can move more. But I think for me it's probably not going to be an issue, and like even though the lip tie comes quite far up and reasonably far down, it's not like as far down, like kind of coming down into the gums like I've seen with other people, and I don't have a gap between my teeth or anything like that, so I think I'll be fine. And I think the major benefit to having the lip tie released, as I mentioned, is when I get my braces and my teeth are moved to a more reasonable position. Because if I didn't get it released, that would cause more strain and more stretch. So I think it's mostly preventative, the lip tie release, so that when I get the braces it doesn't get worse. I did forget to ask about brushing, because obviously like with brushing it doesn't affect the tongue, tie, wound site, whatever, but it would be on the gum line for the lip. I forgot to ask about that, but I guess just be sensible, you know, just do it like gently around it and stuff like that. Probably still use the toddler toothbrush, at least in the front. Or still, more like use it again, like I did after my wisdom teeth. But yeah, I'm feeling really good about it. I'm feeling excited to do it. I'm really interested to see what happens. I've got the exercises now from the speech therapist, which actually, I mean, I only saw her yesterday. I kind of already feel like it's helping, which is super positive, super good. Obviously, it's still very, very early days, and I need to make sure that I do them properly and very regularly. But yeah, and apparently the surgeon said that I should be able to do the exercises again after 5 days. So obviously let the wounds heal initially, and she said that after 10 days I'll need to have the stitches out. They will be dissolvable stitches, but it takes maybe about a month for them to dissolve, so they'll still take them out after 10 days. And then if I want to, or if I feel like I need to, then I can massage the scar, but she said that it's like not necessarily. But yeah, 5 days before I can do the exercises again. That is all for now, and I'll speak to you again soon. Hey, how's it going? Today is Tuesday, and I am super disappointed because I was supposed to be having my tongue and lip ties released tomorrow morning, but at lunchtime I got a call from the practice to say that unfortunately the surgeon needs to be in another operation and they have to postpone it for a week. I was so looking forward to having it done. I was so excited to go into the next step of this whole jaw surgery journey and to see, you know, what relief and positive effects I might already get from having the ties released. I've seen from other people who don't have wider issues, who just need the ties released, that's already great for them. Obviously I have more stuff going on, so I wasn't, you know, expecting and pinning all my hopes on it definitely making things better already, but I was very hopeful and excited to see whether that would be the case. So yeah, super disappointing, super unfortunate, and quite impractical because, you know, it's like within less than 24 hours it cancelled. I had the day off work tomorrow. I just so happened to then have the Thursday and Friday also off. So that was, you know, a lot more convenient for me in terms of not having to worry about how long I'd need for recovery and how long I would need to be off work for. I'd just be off for the rest of the week and come back on Monday, but now I've had to move that to the Wednesday, and yet it's also not as convenient. I think I told you before I was kind of getting mixed messages about how long I would need to be off for. Like the first two places I had made appointments with, they said, yeah, maybe you should take the rest of the day off. Let's see. And in this place, they said, maybe take 5 days off. So I'm really not sure, but I let work know that, like, I think I'll be able to work the next days, but I just might not be able to speak. So let's see, and I let them know that, you know, I would obviously have to update them closer to the time and just see how I feel, so that's fine. Yeah, not ideal, but at least then in the meantime, in the next week, I can keep doing the exercises that I've been given for the tongue. I'm supposed to do them 4 times a day-ish. The speech therapist was a little bit non-committal about that as well. It's quite hard to do it 4 times a day, to be honest. I do it at least 3 times a day, and most days I do get 4. But then, you know, if I like go out in the evening or something like that, then it's harder. But yeah, at least I can keep doing that in the meantime, because even though all 3 of the providers that I spoke to here said that I don't really need to have any sort of speech therapy or myofunctional therapy beforehand. We don't have myofunctional therapists in Germany, it all just comes under the bracket of speech therapists. But I know that like from these support groups, especially like people in America who seem to have all kinds of people, they're like very, very borderline aggressive about this idea that you need to have like however long of the myofunctional therapy first. But that's not what I'm hearing, and it's not what I have access to, okay? So don't attack me like, oh, we seek professional medical advice. I have, all 3 of them told me it's fine, I don't need to, okay? For my circumstances. Anyway, but then at least in the next week I can continue with these exercises so that I can, you know, still get some benefit out of those before the procedure, and then I will continue doing them and going to the speech therapy after as well. Again, all with the aim of using my tongue correctly, having it in the proper position so that it doesn't counteract the braces when I get them on, and to hopefully lessen the chance of like relapse and other associated issues as well. So yeah, disappointed, but trying to see the best. And yeah, hopefully then it will definitely happen next Wednesday. I'll check in with you again then. Hey, how's it going? Try not to look at my mouth. I unfortunately started developing a cold sore a couple of nights ago, just suddenly, so that's what this is, and I have one of these patches on it to protect it and help it heal. It looks disgusting and horrible. It's getting ready to fall off, but you can't peel off because it's sticky, okay? So just ignore it, don't look at it. So today is Tuesday, and tomorrow I am getting my tongue and lip ties released, so just coming in to check in before that. So yeah, I was supposed to have it last week, it's now been delayed. It should be happening tomorrow. I called them to check that it's still okay to go ahead with the cold sore, and they said that it is, but it might just be a little bit more painful for me. But it's fine because of where it's positioned. I'm pretty sure it'll be okay. I'm really glad that they're okay to proceed, because I didn't want to have it delayed again. I guess that's all for just now, and I will see you again after I've had the releases. Yo, y'all know I can't keep anything short. So let's go ahead and split this vlog into 2 parts, okay? So we've talked about the tongue and lip tie, starting speech therapy, and the consultations for the release. Let's leave this here and come back for part 2, which will be more on the surgery itself, the recovery process, how things have or have not improved since having the release. Spoiler alert, today is the day of surgery. I'm having it in a couple of hours, and there may be a slight change of plans based on the information I got yesterday. So I will speak to the surgeon about it and let's see. So if you enjoyed this video, please like, comment, share, and subscribe for the part 2 then to see what happens. Alright, see you later. Bye.